This one is Valgo. Alright. It's more AP than it is ML. So this 5 is right on that cortical margin.
Little bit on the edge, maybe.
See.
With 5.
See. With the 4, we have to flex it out a lot.
Yeah.
Yeah. Alright, I'll just go
Let's
here
try
and
with
show
4.
you. This is your 4.
Maybe a better mediolateral cover, but you say you have to flex a lot.
See.
Yeah, a lot of flexion. There's a 7, maybe too much. Maybe 5 is the best compromise in this situation. Less flexion.
See. Let's see. 3.5 degrees.
Yeah, 3.5. Just a little bit overhang mediolaterally.
Right there.
Okay.
Yep. See. On the tibia. That's the 4. Good coverage. The 5 is.
Let's see the whole proximal distal cover with 5. Okay. Let's see with 4 now.
See?
And 5 again. Huh. Maybe 4. There is a little bit of overhanging medially. I don't like that.
See? And there's a
Maybe.
little bit of anterior as well.
Yeah. I think that 4 is better.
Okay.
So slope 3 degrees, as usual in this
As usual.
case,
See?
with a cruciate retaining total knee arthroplasty,
Yes, sir.
and the HPA angle is 6.4 valgus. Okay. Then we'll play with the gap balance to choose how much to correct.
See.
Perfect. Something more?
Perfecto. No, sir.
Wonderful.
About it.